Hello everyone. In this video, we are going to study about respiratory disorders of acid-base balance, that is respiratory acidosis and respiratory alkalosis. Respiratory acidosis is due to primary excess in partial pressure of carbon dioxide. Partial pressure of carbon dioxide is a measure of carbonic acid which is present in the denominator in the Henderson-Hasselbalch equation, and here, due to increase in carbonic acid level, the ratio of bicarbonate to carbonic acid becomes less than 20. And here you can observe that increase in carbonic acid level will decrease the pH. So the change in carbonic acid and pH is in opposite direction. Causes of respiratory acidosis. This condition is characterized by increase in hydrogen ion concentration, decrease in pH, and increase in partial pressure of carbon dioxide, and it is caused by disorders that interfere with the usual ability of lungs to expel carbon dioxide. So when there is obstruction to respiration in conditions like chronic obstructive pulmonary disease, if there is trauma to thorax, or when there is respiratory muscle weakness. It can occur if a person is taking respiratory repressant drugs like morphine, or in the conditions of hypoxia like in cardiac failure. In respiratory acidosis, due to increase in carbonic acid level, the ratio of bicarbonate to carbonic acid becomes less than 20. So body tries to bring back this ratio to normal by increasing the bicarbonate level in blood. And this condition affects mainly respiratory system, so that's why renal compensation plays a very important role here. So this bicarbonate level in blood can be increased by increased reabsorption of bicarbonate by kidney. Second, by increasing secretion of hydrogen ions and generation of new bicarbonate. And third mechanism is increased production of ammonia and excretion of hydrogen ions as ammonium ions. Let's see the biochemical changes that occur in various stages of compensation in respiratory acidosis. So in respiratory acidosis, pH is decreased, bicarbonate level is normal, and PCO2 is increased, the ratio is less than 20. In partially compensated state, pH is decreased, both bicarbonate and partial pressure of carbon dioxide are increased. This bicarbonate increases as a result of compensation, and the ratio is still decreased, that is less than 20. In fully compensated respiratory acidosis, pH and ratio becomes normal, but bicarbonate and PCO2 are still increased. The maximum limit of compensation for bicarbonate is 32 milliequivalent per liter, and for every 10 millimeters mercury increase in PCO2, there is 1 milliequivalent per liter increase in bicarbonate level. Respiratory acidosis is managed by restoring ventilation and treating the underlying dysfunction or disease. Coming to respiratory alkalosis, it is due to primary deficit of partial pressure of carbon dioxide. So here we can see that the carbonic acid level is decreased, and decrease in carbonic acid level leads to increase in this ratio of bicarbonate to carbonic acid, and we can see that change in carbonic acid level and change in pH are in opposite direction. Causes of respiratory alkalosis. This condition is characterized by decreased hydrogen ion concentration, increased pH, and decreased PCO2. It is caused as a result of hypoxia in high altitude or in case of severe anemia. It can be caused due to overbreathing in case of anxiety or due to hysterical hyperventilation, or it can be caused due to high temperature, that is in cases of fever. In respiratory alkalosis, decrease in carbonic acid level leads to increase in bicarbonate to carbonic acid ratio, that is it becomes more than 20. So body tries to bring back this ratio to normal by decreasing bicarbonate level in blood, and this is brought about by decreasing the various renal mechanisms, that is first by decreasing reabsorption of bicarbonate, second by decreasing secretion of hydrogen ions and generation of new bicarbonate, and third is by decreasing production of ammonia and excretion of ammonium ions. Coming to the biochemical changes that occur in various stages of respiratory alkalosis. In respiratory alkalosis, pH is increased, bicarbonate is normal, PCO2 is decreased and ratio is more than 20. In partially compensated state, pH is still increased, PCO2 is decreased, and as a compensatory mechanism, bicarbonate level is decreased and ratio is still more than 20. In fully compensated condition, pH and ratio becomes normal and bicarbonate and PCO2 are still decreased. The maximum limit of compensation is 15 milliequivalent per liter for bicarbonate, and for every 10 millimeters of mercury decrease in partial pressure of carbon dioxide, there is 2 milliequivalent per liter decrease in bicarbonate occurs in the body. Management of respiratory alkalosis is done by correction of identifiable cause, oxygen supplementation, reduction of anxiety, and rebreathing in a closed paper bag. So I conclude this topic on disorders of acid-base balance by summarizing it. I want you to remember this Henderson-Hasselbalch equation very well to understand the various acid-base disorders. So in metabolic acidosis, there is decreased pH, decreased bicarbonate, and as a compensatory mechanism, there is decreased PCO2. In metabolic alkalosis, increased pH, increased bicarbonate, and as a compensation, there is increased PCO2. In respiratory acidosis, there is decreased pH, increased PCO2, and as a compensation, there is increased bicarbonate level. In respiratory alkalosis, pH is increased, PCO2 is decreased, and as a compensation, bicarbonate level is also decreased. The next topic on acid-base balance and imbalance, part 4, is ABG analysis based on the values of pH, bicarbonate, and partial pressure of carbon dioxide. Thank you.